Thank you so much for being a valued supporter of the Kidney Foundation BC and Yukon branch. As part of our research roundup follows an interview with Dr. Lamarche, who received a 3-year KRESCENT Grant in 2017 from the Kidney Foundation, with her results wrapping up in June 2020. Dr. Lamarche's project, based out of UBC, focused on preventing post-transplant rejection in kidney patients. Hi everyone, I'm pleased to welcome you today. We're about to interview Dr. Caroline Lamarche all the way from Montreal, who's going to be talking about her KRESCENT study that was funded by Kidney Foundation. Stay with us shortly. Okay, so I'm here with Dr. Caroline Lamarche. Dr. Lamarche, would you like to introduce yourself and just let us know how you were involved with the Kidney Foundation?
Hi, so I'm a trained nephrologist. I did my nephrology training in Montreal, and then I did a postdoctoral fellowship in Vancouver under the supervision of Megan Livings at UBC. And the project I was working on was funded by the KRESCENT Fellowship. So I was part of the KRESCENT program for 3 years, and it just ended in last June.
Excellent. Thank you so much for that introduction. So I'd love to ask you, what inspired you to get involved in the field of kidney and organ transplant research?
So I think because I'm a nephrologist, the inspiration came from my patients. So I've seen a lot of dialysis patients waiting for a transplant, or kidney transplant recipients that have kidney that is failing, or with bad side effects from the drugs we're giving them. So, and I really hate to be powerless. So I really want to be able to tell them I'm working on it. So I'm trying to make that situation a little bit better. But so I think my main inspiration came from them. But on a more personal level, my aunt also had lupus, and she was on dialysis for 5 years, and then she got a transplant, and because of the immunosuppressive drugs, she also got a cancer, and she died from it. So I think that was when I really decided to become a clinician scientist and to do that for a living.
That's incredibly inspiring. Thank you so much for sharing that and your personal interest as well. So to go into the further into your study, would you please describe your study for which you did receive the KRESCENT Award, Tailoring Antigen-Specific Regulatory T Cells for Use in Transplantation?
Yeah, so that looks a bit complicated, but I'll try to explain it best as I can. So when you receive a transplant, your immune system sees that as foreign. So it starts to attack it and want to reject it. So in order to prevent that, we need to give patient immunosuppressive drugs that are really, really strong. Mm-hmm. But those are coming with a lot of side effects, such as cancer, infection, and cardiovascular disease. So my project, what we're aiming to do is to take the immune cells from a patient. So we collect the cells, we modify them in a lab, and we want to re-inject the patient his own immune system, but that has been improved to better tolerate and keep the graft. So if we succeed in that, we won't need to use the bad immunosuppressive drugs.
That makes sense. I'm just curious, like as a follow-up question, you said that cancer could actually be a side effect. Is there a particular kind of cancer, or is it dependent on the person, or?
It's mostly skin cancer.
Oh, okay.
But it's also lots of different cancers. And also some cancer are related to infection. So if we bring down your immune system too low, then you have more infection, and some of them can cause cancer in the long term.
That's very interesting. Thank you for elaborating on that. So why, in your opinion, or Why is this field an essential area of study to improve the rate of successful organ transplants in the long term? And what does it mean for kidney transplant patients?
Yeah, so I think it's playing on all levels. So if we improve tolerance, so that's how you don't reject the organ and you keep it. We can increase graft survival. So that's directly an impact on the patient. But also, if we can decrease the amount of immunosuppressive drugs, we can decrease all the bad side effects. So in that way, we can increase patient survival and patients' quality of life.
Right.
But also, I don't know if lots of people know about it, but on the transplant list, there are actually lots of patients that are waiting for a second or third transplant because they lost a previous graft. So if we can improve graft survival, we can also help patients that are on the waiting list, waiting for a kidney.
Perfect. And thank you for elaborating on that, because I think even in the general public, a lot of people don't realize that just because you get a transplant, it's not like, bam, we're done.
No, exactly. So graft survival is not perfect. I think we can improve that. And once you have a transplant, you need to understand that you'll need to take the drug for the rest of your life. So it's not magical.
Exactly, and I love how you noted the quality of life aspect of it as well.
Yeah.
So what were some main highlights and outcomes as a result of your study?
Yeah. So when I joined the lab, they've used the technology that we're aiming to use. They showed that this technology is really good to prevent graft rejection in mice. But my work was to bring this technology from mice to human. So I think that's a really, really important step, especially for a clinician, because I want to see the impact in patient. Mm-hmm. So we were able to do that, so to bring this technology and humanize it, so make it more suitable for human. And the first clinical trial should start in 2021 probably. I don't know because of COVID, but it will be used and tested in human. So I'm really proud that I was able to do this bridge between mice and human. That's
fantastic.
And then, so I was working on 3 different little projects. So my second project was, we asked ourselves the question, when is the best time to use this technology? Is it better to use it to prevent rejection or to treat rejection once it's there? And also don't want to enter into the details, but there are 2 types of rejection, and we knew this technology would work on one, but we've shown that it's actually good to prevent both type of rejections, and it's better to use them in prevention than in treatment. So we were able to define this a little bit better in order to plan the first in-human clinical trial.
That's very interesting. And yes, thank you for noting that. So you were working under Dr. Megan Loving's lab at UBC, correct? And so it was using technology that they had already used, and yet collaboratively you were able to expand upon that. Is that correct?
So working with them, I needed their coaching, but we modified the technology to adapt it to human.
Yeah, that makes sense. Thank you. And so what did receiving a KRESCENT grant as a postdoc student mean for you as a young postdoc researcher, and how did it help in the beginning of your career?
Yeah, so I don't know if people know about that, but the KRESCENT Fellowship is not only a salary grant or money, it's also, we have meetings twice a year. And in those meetings, we have lots of tips and conferences on how to become a young investigator, how to go from a PhD or postdoc researcher to a young investigator, and then from a young investigator to a successful principal investigator. So those meetings were incredible in order to go from one step to another. So I think it really helped me into that. And like I just said, I just started my lab. So I think I'm using all those tips currently and I'm applying those. But also in those meetings, it was really about meeting other Canadian researchers and meeting the community and building a network. Because now in science, we need to collaborate together and work all together. So I think those were the two main things for me.
That's fantastic. Yeah, lovely. Thank you for sharing that. And what do you view, in your opinion, as the most important opportunities or pressing needs for research right now in the field of kidney disease and organ transplant?
So I'll preach for my work.
Yeah.
I'll say that in kidney transplant, it's really, really about developing that tolerance. So how to accept the kidney and the graft without all those drugs, with those bad side effects. And also, if we are tolerant, we won't have rejection and we'll be able to increase graft and patient survival. So I think that should be our main goal. But also, if you go a little bit broader than that, if we learn to play with the immune system a little bit better, we could also get better at treating other diseases like autoimmune diseases where your own immune system attack your kidneys and your body, to prevent chronic kidney disease. So to work a little bit before transplant. Hopefully patients won't need a transplant if we're better.
Well, and does that go a little bit back to what you were saying with your aunt and like lupus, for example, as a pre-existing condition that would result in?
Yeah, exactly. So because of her lupus, she lost her kidneys. And so if we could prevent that, that would be amazing. But also, in order to treat her lupus, we gave her those bad immunosuppressive drugs that in the end, with the transplant, caused cancer. Right. So I really think we can do better, and we'll be able to help lots of patients if we do that.
That's very interesting. Thank you so much for sharing that. And just a little bit of a side note, I'm curious as to, you mentioned COVID-19 a little bit earlier on, and do you want to go into a little bit of the impact that COVID is going to have on your field of research and how you operate in the lab, as well as the impact it might have on chronic kidney patients?
Yeah, so of course, COVID-19 was is really hard on us, especially in basic science, because we usually need to work in closed spaces, like in labs. We work usually all together, and the lab were closed for a while, and they're just starting to open up again. And we have to work with reduced teams or to schedule everything not to be at the same time. So it's a bit difficult in that regard. I think the good thing about COVID-19 is that it opened up to lots of collaboration between researchers. So it was not our expertise. None of us were experts in COVID because it didn't exist, but we're now all trying to work together to find ways to improve patients' care and patient survival. So I think for us as a nephrologist as well, it had a huge impact for our patients because all our patients are high risk. So all the CKD patients and of course all the transplant recipients are high risk. So yeah, we're really trying to study how their immune system reacts to COVID-19 and try to improve that.
So that was really something interesting that you noted. Are there some common questions that you're facing from your kidney patients living with chronic kidney disease? And what are some of those questions and how are you addressing them?
Yeah, so it's really about, I think there's a lot of anxiety coming from our patients. So it's really what are their chances of survival? What should we do with their meds if they have it? Should they send their kids to daycare and school? And what should they do about it? And it's really hard for clinicians because we don't have those answers. So we have a little bit of data, but it's really sparse. And we would love to have the right answer and say, oh, yeah, it's okay. It's not your risk are this, and this, but it's all a bit blurry still. So yeah, we would like to reassure them a little bit more.
Thank you for sharing that. Yeah, from your perspective, it's not black and white. We're all trying to figure it out together. So Dr. Lamarche, is there any leaving thoughts that you want to leave us with in terms of KRESCENT and how it impacted your career?
Yeah, so I think there's not a lot of women doing research, and there are not a lot of women doing basic research particularly. So it was really useful for me as well to meet other amazing women doing research through the KRESCENT Fellowship. And I think we have to work together in order to have more women doing research.
I love it. Thank you so much for sharing that thought. And also congratulations, 6 weeks, your baby is 6 weeks old now?
Yeah, 7 now.
7 weeks, yes, perfect, thank you. So Dr. Lamarche, I want to thank you one more time. Thank you so much for being here with us today. And it was really a pleasure to have this conversation with you.
Thanks for your time.